Hello, dear students. I am Navruzov Dilshod Kadirovich, lecturer, senior teacher of the department PhD, Department of Nephrology, Hemodialysis, Traumatology, and Orthopedics. Today's topic: methods of immobilization of patient with musculoskeletal system injuries. Today's slide's goal, the basis, is to teach students the technique of immobilization of the musculoskeletal system injuries. Immobilization. Immobilization refers to the creation of immobility of the damaged part of the body. Immobilization is used for the bone fracture, damage to joints, nerves, extensive soft tissue damage, severe inflammatory process in the extremities, injury to large vessels, and extensive burns. There are two types of immobilization: transport and treatment. Transport immobilization, or immobilization during transportation of the patient to the hospital, is a temporary measure from several hours to several days, but it's of great importance for the life of the patient and for the future course and outcome of damage. Transport immobilization is carried out using special splints or made from handmade materials and by applying bandages. Transport tires are divided into fixing splints combining fixation with traction. When transporting over long distance, temporary plaster bandages are also used. Transport immobilization. A plaster cast is convenient because it can be made into any shape. Immobilization with this bandage is especially convenient for injuries of the lower leg, forearm, and shoulder. The inconvenience is that you have to wait until the bandage hardens and dries. You can also bandage the upper limb to the body and the lower limb to the healthy leg. This is a auto-immobilization. Transport immobilization. The Dietrich splint is used to immobilize the lower limb. The tire is made of wood, but nowadays it's made of lightweight stainless metal. Science splints for transport immobilization are not always available at the scene of an incident. You have to use handmade material and improvised splints. For these purposes, sticks, planks, cardboard, umbrellas, skies, tightly rolled clothes are used. Transport immobilization. Plywood splints are used for immobilization of the upper and lower limbs. Wire splints are made in two sizes. From steel wire, such tires are light, durable, and clinically commonly used. The mesh splint is made of soft, thin wire, is well modeled and portable, but insufficient strength limits its use. The basic principles of transport immobilization are as follows. First, the splint must cover into and sometimes even adjacent joints. Second, when immobilizing a limb, it's necessary, if possible, to give it an average physiological position, and if this is not possible, a position which the limb least injured. Third, in case of closed fracture, it's necessary to carry out light and careful traction of the injured limb along the axis before the end of immobilization. Fourth, for open fracture reduction of fragment, it's not performed a Sterile bandage is applied and the limb is fixed in the position in which it's located. Fifth, don't remove the patient's clothing. 6. You cannot apply a hard splint directly to the body. You must place a soft bedding, cotton, wool, a towel, etc. 7. An assistant should hold the injured limb while transferring the patient from the stretcher. Transport immobilization. We must remember that incorrectly performed immobilization can cause harm as a result of additional trauma. Thus, insufficient immobilization of closed fracture can turn it into an open one, aggravating the injury and worsening its outcome. Transport immobilization for neck injury. Transport immobilization of the neck and head is carried out using a soft circle, a cotton gauze bandage, or a special Lansky transport splint. When immobilizing with a soft pad, the patient is placed on stretcher and tied to prevent movement. A cotton gauze circle is placed on a soft bedding, and the patient's head is placed on the circle with the back of his head in the hole. Immobilization with a cotton gauze bandage, shanks type collar, can be done if there is no difficulty breathing, vomiting, or aggression. The collar should rest against the occipital protuberance and both mastoid plexus and rest on your chest from below. This eliminates lateral head movement during transport. When immobilized with an Lansky splint, a more rigid fixation is provided. The tire is made of plywood and consists of two halves, fastened together with harness. When unfolded, the tire reproduces the contours of the head and torso. In the upper part of the tire there is a recess for the back of the head, on the sides of which two semi-circumferential oil closes rollers are placed. The splint is attached with ribbons to the body and around the shoulder. A layer of cotton wool is applied the splint. Transport immobilization for the spinal injury. The purpose of immobilization in case of spinal injury is primarily to eliminate half mobility of the damaged vertebra during transportation, unload the spine, and securely fix the area of injury. Transporting a patient with vertebral damage always poses a risk of injury from displaced vertebra of the spinal cord. Immobilization in case of damage to the lower thoracic and upper lumbar vertebra is carried out on stretcher in the position of the patient on his stomach, with a pillow or rolled up clothing placed under the chest and head to unload the spine. If the stretcher is equipped with a rigid one, a board, plywood splints, sheet of plywood, etc., a blanket folded in several layers is placed on the flooring, and the patient is placed face up on it. An important point in transporting a patient with a spinal injury is placing the patient on the stretcher, which must be done 3 or 4 people. Transport immobilization for damage to shoulder girdle. If the collarbone or scapula is damaged, the main goal of immobilization is to create rest and eliminate the heaviness of the arm and shoulder girdle, which is achieved with the help of scarf or special splints. Immobilization with a scarf is carried out by hanging the arm with a roller placed in the armpit. Immobilization can be carried out using a Deso bandage and A-shaped bandage. Immobilization for fracture of the humerus. For fracture of humerus in the upper third, immobilization is carried out as follows. The arm is bent at the elbow joint at an acute angle so that the hand rests on the nipple of mammary gland on the opposite side. A cotton gauze roll is placed in the armpit and bandaged across the chest to the healthy shoulder girdle. The forearm is suspended on a scarf and shoulder is fixed with bandage to the body. Immobilization with a leather splint is performed for fracture of the humeral diaphysis. The leather splint for immobilization is wrapped in cotton wool and modeled after the patient's uninjured limb. The splint must fix 3 joints: shoulder, elbow, and wrist. A cotton gauze roll is placed in the axillary fossa of the injured limb. Immobilization for fracture of the humerus. The splint is fixed to the limb and torso with bandages. Sometimes the head is suspended on a scarf. If the fracture is localized in the elbow joint, the splint should cover the shoulder and reach the metacarpophalangeal joints. Immobilization for fractures of the humerus. Immobilization with a plywood splint is carried out by placing it on the inside of the shoulder and forearm. The splint is bandaged to the shoulder, elbow, forearm, hand, leaving only the finger free. When immobilizing with improvised means, sticks, bundles of straw, bracers, planks, etc., certain conditions must be observed. On the inside, the upper end of the splint must reach the armpit. The other end of the outside must protrude beyond the shoulder joint and the lower ends beyond elbow. After applying the splints, they are tied below and above the fracture side to the shoulder, and the forearm is suspended on a scarf. Forearm injury. When immobilization the forearm, it's necessary to lose movement in the elbow and wrist joints. Immobilization is carried out with a leather or mesh splint after it's curved with a groove and covered with a soft bedding. The splint is applied along the outer surface of the affected limb from the middle of the shoulder to the metacarpophalangeal joints. The elbow joint is bent at a right angle. The forearm is brought to an intermediate position between pronation and supination. The hand is slightly extended and brought to the abdomen. A stick roller is placed in the palm. A splint is bandaged to the limb and the hand is suspended on a scarf When immobilizing with a plywood splint, cotton wool must be used to prevent bed sores. To immobilize the forearm, you can use handmade material, following the basic rule for creating immobility of the injured limb. Injury to the wrist and finger. For injuries in the area of the wrist joint of the hand and finger, a leather or mesh splint served in the form of a groove, as well as plywood splints in the form of strips from the end of the finger to the elbow are widely used. The splints are covered with cotton wool and applied from the palmar side. The splint is bandaged to the hand, leaving the finger free to monitor the blood circulation. The hands are given an average physiological position, and the stick roller is placed in the palm. Transport immobilization for pelvic injury. Immobilization of bone injury of the pelvic is a difficult task since even involuntary movements of the lower limb can cause displacement of fragments. For immobilization in case of pelvic injury, the victim is placed on a rigid stretcher, placing him in a position with his legs bent and slightly apart, which leads to muscle relaxation and pain reduction. A cushion is placed its popliteal area a blanket clothing, rolled up pillow, etc. Transport immobilization for injury of the lower limb. The correct immobilization for a hip injury should be considered to be one that involves three joints at once, and the splint is applied from the armpit to the ankles. Immobilization using Dietrich's splint. This splint combines the necessary condition for proper immobilization in case of a femur fracture fixation and traction at the same time. It's suitable for all levels of hip or tibia fracture. The splint consists of two wooden sliding planks of different lengths, 8 cm wide, a wooden foot rests for traction, and a twist stick with a cord. A long bar is placed on the outer surface of the thigh from the armpit, and short bar is placed on the inner surface of the leg. Both planks have transverse struts at the top for support. Since the slats are sliding, they can be given any length depending on the height of the victim. A sole is bandaged to the foot, which has an attachment for a cord. A stop with a hull through which the cord is passed is tightly attached to the inner bar of the tire. After applying the splint, twist the cord until tension is achieved. The splint is fixed to the body with soft bandages. Immobilization with a leather splint. For immobilization with a leather splint for the hip fracture, 3 splints are taken. 2 of them are tied along the length from the axillary fossa to the foot, taking into account its bending onto the inner edge of the foot. The third splint is applied from the gluteal fold to the toes, If there are several splints of force, one can be applied from the perineum to the inner edge of the foot. Immobilization with plywood splints is carried out in the same way as with stair splints. Improvised splinting for hip fracture is carried out using various available devices. Immobilization of the lower leg. Transport immobilization of the lower leg is carried out using special plywood splints, wire ladder splints, dietrich splints, and improvised splints. To properly apply a splint for fracture of the shin bones, you need an assistant to lift it by the heel and, as if taking off a boot, begin to smoothly pull the leg. Then the splints are bandaged on the outer and inner sides so that they go above the knee joint and below the ankle joint. The most convenient and portable for tibial fracture is a ladder splint, especially in combination with a plywood splint. Immobilization is achieved by applying a ladder splint well modeled along the contours of the limb, along the back surface of the limb, from the gluteal fold with the addition of two plywood splints on the sides. The splints are fixed with a gauze bandage. Thank you for attention.